Hello and welcome, dear students. Today we are going to discuss about the topic color blindness. The main objectives of today's lecture are to know the basics of color blindness, to know the history of color blindness, to understand the medical implications of color blindness, to discuss about the inheritance patterns, to discuss about the diagnosis of color blindness, to discuss about the genetics of color blindness, and finally to discuss about the inherited and acquired color blindness. Dear students, let's start with the introduction first. Color blindness or color vision deficiency, that CVD, is the decreased ability to see color or differences in color. Color blindness can be simply defined as the trouble in seeing or identifying colors like blue, green, and red. There are some rare cases where a person cannot see and identify any colors at all. A person with this syndrome also finds difficulties in differentiating the colors with shades. This syndrome is also called a color vision problem or color vision deficiency. It can impair tasks such as selecting ripe fruits, choosing clothing, and reading traffic lights. Color blindness may make some academic activities more difficult. However, issues are generally minor and the color blindness automatically develop adaptations and coping mechanisms. People with total color blindness, that's achromatopsia, may also be uncomfortable in bright environments and have decreased visual acuity. The most common cause of color blindness is an inherited problem or variation in the functionality of one or more of three classes of cone cells in retina, which mediate color vision. It is most commonly caused by a genetic disorder called congenital red-green color blindness. Males are more likely to be colorblind than females because the genes responsible for the most common forms of color blindness are on the X chromosome. Non-colorblind females can carry genes for color blindness and pass them on to their children. Color blindness can also result from physical or chemical damage to the eye, the optic nerve, or parts of the brain. Screening for color blindness is typically done with Ishara color test. There is no cure for color blindness as it is a genetic disease. Diagnosis may allow an individual to actively accommodate the condition. Special lenses such as N-chroma glasses or X-chrome contact lenses may help people with red-green color blindness at some color tasks, but they do not grant the wearer normal color vision. Red-green color blindness is the most common form, followed by blue-yellow color blindness and total color blindness. Red-green color blindness affects up to 1 in 12 males and 1 in 200 females. The ability to see color also decreases in old age. In certain countries, color blindness may make people ineligible for certain jobs such as those of aircraft pilots, train drivers, crane operators, and people in the armed forces. Color blindness was discovered by an English chemist named John Dalton in the year 1798. During the discovery, he was also suffering from color blindness. He wrote his first article about color blindness, which was based on his own experience. Color blindness is also called as daltonism, which is named after its discoverer, John Dalton. Dear students, let's know about the history of color blindness. During the 17th and 18th century, several philosophers hypothesized that not all individuals perceived colors in the same way. The phenomena only came to be scientifically studied in 1794 when English chemist John Dalton gave the first account of color blindness. Genetic analysis of Dalton's preserved eyeball confirmed him as having deuteranopia in 1995, some 150 years after his death. Influenced by Dalton, German writer J.W. von Goethe studied color vision abnormalities in 1798 by asking two young subjects to match pairs of colors. Holmgren created the first test for color vision using multicolor skeins of wool to detect color blindness. In 1920, Frederick William Eldridge Green devised an alternative theory of color vision and color blindness based on Newton's classification of 7 fundamental colors, that's ROY-GBIV. Eldridge Green classified color vision based on how many distinct colors a subject could see in the spectrum. Normal subjects were termed hexachromic as they could not discern indigo. Subjects with superior color vision who could discern indigo were heptachromic. The colorblind were therefore dichromic, means equivalent to dichromacy, or tri-tetra or pentachromic, that is anomalous trichomacy. Dear students, let's now discuss about the medical implications of color blindness. There is no known association between the inherited forms of color blindness and any other kind of blinding eye disorder. However, acquired color blindness is symptomatic of many blinding disorders such as glaucoma, diabetic retinopathy, and macular degeneration. Acquired color blindness is also a symptom of exposure to certain toxic drugs and chemicals. In all cases, detection of the acquired color vision loss can be an important tool in diagnosis and treatment. However, a pre-existing congenital color vision defect can make an accurate diagnosis difficult. A genetic test for congenital color vision defects would clearly be extremely valuable in diagnosing acquired color vision loss. Dear students, let's talk about the inheritance patterns. Congenital red-green color vision defects are characterized by the absence of functional expression of either L or M pigment. The genes encoding these pigments lie on the X chromosome, and thus color vision defects resulting from mutations within the L and M genes are inherited as X-linked recessive traits. This accounts for the pronounced sex difference in the frequency of red-green color blindness. Trichotillomania inherited as an autosomal dominant defect with incomplete penetrance. The defect has been shown to be caused by missense mutation in the S-cone pigment gene, which lies on autosome 7. Complete achromatopsia is inherited as an autosomal recessive trait or character. A mutation in the gene encoding a subunit of a cone-specific cation channel has recently been shown to underlie some cases of this disease. Additional genetic causes of this disease are also under investigation. Dear students, let's discuss about the types of color blindness. There are several different types of color blindness which may be subdivided generally into dichromacy, that is dichromatism, when only two cone types are functional, and monochromacy, that is monochromatism, when none or only one type of cone receptor is functional. Dichromatic individuals are ordinarily unable to distinguish between red and green. Blindness to red is known as protanopia, a state in which the red cones are absent, leaving only the cones that absorb blue and green light. Blindness to green is known as deuteranopia, wherein green cones are lacking and blue and red cones are functional. Some persons experience anomalous dichromatic conditions which involve only minor reductions or weaknesses in color sensitivity. In protanopia, for example, sensitivity to red is reduced as a result of abnormalities in the red cone photopigment. In deuteranopia, in which sensitivity to green is reduced, the green cones are functionally limited. Two forms of blue-yellow color blindness are known as trinopia, that is blindness to blue, usually with the inability to distinguish between blue and yellow colors, which occurs when blue cones are absent, and tritonally reduced sensitivity to blue, which arises from the abnormal function of blue cones. Monochromacy or complete color blindness is sometimes accompanied by deficiencies in visual acuity. Such conditions are rare and include achromatopsia or rod monochromacy, the complete absence of functional cones, photopigments, and cone monochromacy when two of the three cone types are non-functional. Dear students, let's talk about the causes of color blindness. The healthy human eye retina contains two light-sensitive cells, that is rod cells and the cone cells. The rod cells are for low light and the cone cells are for normal and bright light and responsible for color vision. Color blindness is affected when these two light-sensitive cells, that is cones and rods, fail to perform their functions. There are several factors which causes a color vision problem in a person. The factors include damage caused to brain or eye or to the nerve cells, genetic disorders, side effects of drugs, use of tobacco and alcohol. Dear students, let's understand the symptoms of color blindness. The primary symptom of color blindness is color confusion, which means that the person may misidentify a color as being something other than what people with normal color vision see. Another symptom is that details or objects may be overlooked or not readily seen if they have a color that is confused with other colors in the surrounding visual scene. Color blindness is not known to be correlated with other eye conditions such as myopia, nor with learning disabilities. As a person with color blindness, color confusion can show itself in many everyday tasks, resulting in frustrating outcomes such as mismatched outfit, questionable paint choices, incorrect color naming, and difficulty in interpreting color-coded information such as charts, graphs, and maps, which may cause problems. Other symptoms of the color blindness include rapid eye movement, sensitivity towards the bright light, trouble in seeing colors, and the brightness of colors. The problem in identifying the differences between color shades. Dear students, let's now discuss about the diagnosis of color blindness. There are certain tests available to diagnose and to measure color vision deficiency in a patient. Color vision test is the one. The main method for diagnosing a color vision deficiency is in testing the color vision directly. The Ishara color test is the test most often used to detect red-green deficiencies and most often recognized by the public. There are totally 38 plates of circles which are created by irregular colored dots using two or more colors. During this diagnosis, patients are asked to identify the number on a plate. Some tests are clinical in nature, designed to be fast, simple, and effective at identifying broad categories of color blindness. Others focus on precision and are generally available only in academic settings. The second test is pseudo-isochromatic plates, a classification which includes the Ishara color test and HRR test. Embedded a figure in the plate as a number of spots surrounded by spots of a slightly different color. These colors must appear identical, that is metameric to the color blind, but distinguishable to color normal person. Pseudo-isochromatic plates are used as screening tools because they are cheap, fast, and simple, but they do not provide precise diagnosis of CVD. The third test is the lanterns. such as the Farnsworth lantern test, project small colored lights to a subject who is required to identify colors of lights. The colors are those of typical signal lights, that is red, green and yellow, which also happen to be colors of confusion of red-green, that is CVD. Lanterns do not diagnose color blind, but they are occupational screening tests to ensure an applicant has sufficient color discrimination to be able to perform a job. Another test is arrangement tests. Arrangement tests can be used as screening or diagnostic tools. The Farnsworth-Munsell 100 hue test is very sensitive, but the Farnsworth D15 is a simplified version used specifically for screening for CVDs. In either case, the subject is asked to arrange a set of colored caps or chips to form a gradual transition of colors between two anchor caps. Another one is anomaloscopes are typically designed to detect red-green deficiencies and are based on the Rayleigh match, which compares a mixture of red and green light in variable proportions to a fixed spectral yellow of variable luminosity. The subject must change the two variables until the colors appear to match. They are expensive and require expertise to administer, so are generally only used in academic settings. Another one is the screening test. This test is mainly used to detect and determine the type and severity of the color blindness. Dear students, let's discuss about the genetic testing. While genetic testing cannot directly evaluate a subject's color vision, that is phenotype, most congenital color vision deficiencies are well correlated with genotype. Therefore, the genotype can be directly evaluated and used to predict the phenotype. This is especially useful for progressive forms that do not have a strongly color deficient phenotype at a young age. However, it can also be used to sequence the L and M opsins on the X chromosome, since the most common alleles of these two genes are known and have even been related to exact spectral sensitivities and peak wavelengths. A subject's color vision can therefore be classified through genetic testing, but this is just a prediction of the phenotype, since color vision can be affected by countless non-genetic factors such as Kuhn mosaic. Dear students, let's now talk about the treatment for color blindness. Currently, there is no treatment for this syndrome or disorder. Photographic frames or filters and eyeglasses with contact lenses can be used to a certain extent to improve the dimension between some colors. A properly balanced diet can be followed to improve the symptoms of color blindness. Patients with the colorblind syndrome face many difficulties in their daily life. They may face difficulties in choosing fresh vegetables, fruits, flowers, differentiating the pulses, driving a car, selecting clothes, and much more. The most common type of inherited color blindness is red and green color blindness. As per the studies and medical records, red and green color blindness is seen more in men than in women. Dear students, let's discuss about the genetics of color blindness. The most common type of color blindness, red-green color blindness, which includes proton type and deuterium type color vision deficiencies, is a genetic condition. 1 in 12 men have this common form of color blindness, while only 1 in 200 women or females have it. That is because the genes responsible for this type of color blindness are located on the X chromosome, and men have only one X chromosome. If the recessive trait is present, there are color blindness. A woman must have this recessive trait on both of her X chromosomes to be colorblind. if only one of them doesn't affect her, but she can pass this on to a male child. Women can be carriers of the colorblind gene and pass the mutation down the family line. If only the father is colorblind, there is a 100% chance that his daughters will carry the gene, but they will not be colorblind themselves. His sons will neither carry the gene nor be colorblind. If the mother carries the gene but is not colorblind, there is a 50% chance that her sons will be colorblind and a 50% chance that her daughters will carry the gene. When a colorblind father and a mother who carries the colorblind gene have children, there is a 50% chance that their sons will be colorblind. Their daughters, however, will have a 50% chance of being colorblind and 100% chance of being carrier of the gene. Alternatively, a colorblind mother and a non-colorblind father will have all colorblind sons and will have daughters who all carry the colorblind gene. Finally, if both parents are colorblind, their sons and daughters have a 100% chance of being colorblind and their daughters have a 100% chance of carrying the gene. Some types of color blindness increase with age or develop as a symptom of certain diseases or exposure to toxins like mercury and are not linked to heredity. Dear students, let's understand the inherited and acquired color blindness. Hereditary red-green color blindness occurs mainly in males and Caucasian persons, with about 8% of men and about 0.5% of women of European ancestry inheriting the conditions. Its predominance in males is due to the fact that red-green color blindness is a sex-linked recessive characteristic carried on the X chromosome. Hence, the trait for red-green color blindness is passed from mother to son, from mother to daughter, or from mother and father to daughter. A son who inherits the trait from a carrier mother will be red-green color blind. Males inherit only one X chromosome directly from the mother. A daughter who inherits the trait from a carrier mother with a normal father will have normal color vision but be a carrier of the trait. A daughter who inherits the trait from both her mother and her father will be red-green color blind. Blue-yellow color blindness, by contrast, is an autosomal dominant disorder and therefore is not sex-linked and requires only one copy of the defective gene from either parent to be expressed. Achromatopsia is an autosomal recessive disorder occurring only when two copies of the defective gene, one from each parent, has been inherited. Persons who inherit color blindness may show symptoms at birth, congenital color blindness, or they may become symptomatic later in childhood or adulthood. Acquired color blindness is usually of the blue-yellow type and ranges from mild to severe. Often it is associated with chronic disease such as macular degeneration, glaucoma, diabetes mellitus, retinitis pigmentosa, or Alzheimer's disease. Certain drugs and chemicals can also cause acquired color blindness. Dear students, let's now summarize the lecture. Color blindness is the inability to distinguish one or more of the three colors red, green, and blue. Most people with color vision problems have a weak color sensing system rather than a frank loss of color sensation. In the retina, the light sensitive layer of tissues that lines the back and sides of the eyeball. Humans have three types of cones: the visual cells that function in the perception of color. One type absorbs light best in wavelengths of blue-violet and another in the wavelengths of green. The third type is most sensitive to longer wavelengths, more sensitive to red. So normal color vision, when all the three cones or all the three types of cells are functioning correctly, is known as trichomacy or trichromatism. Dear students, it was all about today's lecture regarding color blindness. Hope you have understood it well. See you with next time with a new topic. Till then, take care and goodbye.